quite a few years ago, transferred over into the alternatives background. So we're excited to have him here. He is the medical director of the Alternative Center at George Dewey Medical Center in Subic. And so we are excited to have him here. He will talk to you about arthritis tonight. And we know that you will be well informed, and we know that you are going to be someone who's going to walk out of here with more knowledge than when you came in, okay? And that's what we're looking for. That's what we want to, that's what we want, that's why we do these things, is because we want you to be well informed about all the different diseases so that you can tell people, hello? We got conversations going on here.
Sorry.
It's all right. We want to tell people as much as we can about how great Life Enzyme is in helping people relieve diseases like arthritis. So anyway, without further ado, he has been here many times before, so he really doesn't need any introduction, but without further ado, let's bring up Dr. Dizon and have him talk to you about arthritis tonight. Let's give him a big hand.
Thank you, Andrew. Again, it is a privilege to be able to share with you some things. I was asked or requested by Andrew if I had some lectures about arthritis. We do have, but I kept looking for it and I think I misplaced some of my lectures. So we will be studying about arthritis. At least we give you a background. A few months back, I shared with you basic techniques for health, right? Acupuncture, cleansing diet, and so on. It's basically the same treatments. You have heart disease, same dieting. You've got cancer, same dieting, although a little bit more intensive. So you have heard the therapies that we have shared before. Are there any new attendees? So 1, 2, 3. Okay. So I'll have to give them a little background, but you should have heard some of these things already. Okay. Yan. Arthritis, no? Nature's way to cure arthritis. Diba maganda, no? My nurse, Chris there, helped me make it nicer. Kasi it was getting boring, no? She helped me set it up. We needed new blood for the alternative things. Arthritis. Okay, who has experience here with arthritis? Huh? In medicine, pag sinabing itis, that means inflammation. No? Tonsillitis. Appendicitis. No? So, laging if something is inflamed. There are 3 things that you will see in an inflammation or in swelling. No? We call it redness. We call it rubor or redness. And then dolor is pain. So redness is rubor, no? Rubor is redness. Dolor is pain. And the other one is calor, meaning hot or warm. No? So if it's hot, it's swelling, and it's painful, that's an itis, no? Itis. Arthritis, no? So there are hundreds of different conditions and diseases that affect the joint. So if you say rheuma, no? Rheuma is a generic term for swelling of the joint. It can be rheumatoid arthritis, it can be osteoarthritis, it can be some gouty arthritis. So when a patient asks me, Doc, anong magandang gamot sa rheuma? Okay, so I ask them, ano pong rheuma? What kind of arthritis do you have? Is it gouty? Kasi if it depends on the cause. Gouty, uric acid. Is it osteoarthritis? Age and weight bearing. You do something about the weight. If it's rheumatoid arthritis, you do something about the immune system that is attacking the joint. It has to depend on what the cause is. Of course, medicine just gives steroids and pain reliever. So it's common in adults, 65 and older, and in med school they tell us it's part of aging, or part of life. So maraming tao yan. Unfortunately, in 1988, 2 million prescriptions were given for arthritis medications. Out of 2,200,000 developed side effects, and 20,000 died of bleeding ulcers. So yun yung mga alaksan na naproceed, the non-steroidal anti-inflammatory drugs. No? So yun ang side effect, ulcer, liver, kidneys. So there's patients that have had kidney failure because they keep taking their medications like candies. Okay, so osteoarthritis is the most common type. These are for elderly. And usually it hits the hips, knees, and hands. So if it's not swelling like the one in gout arthritis, it can be because of the work that you're doing. What happens to the joints? It gets eroded. The cartilage at the end of the joints gets thinner and thinner, and when they move, there's the crackling sound sometimes. Parang may selfie. Or you touch the area, and when it moves, it's not smooth anymore. It's like we call it in Tagalog, ngipin sa ngipin. Yeah? Ball bearing against ball bearing. No more shock absorber. So that's. Now, rheumatoid arthritis is an autoimmune disease, meaning the immune system is attacking itself and destroying the body's own tissue, specifically the joints. The causes are unknown. Since you don't know what caused it, how can you treat or cure it? So, and because of the inflammation, it damages the hands, wrists, and even the other joints in the body. So the treatment of autoimmune disease is to destroy the immune system.
Oh, God.
Yes. Isn't it wonderful, no? And that's science. Huh? Okay. Anyway, now gouty arthritis, well, as the term implies, comes from uric acid. So this is a layman's term, no? Uric acid from the diet. Too much protein, too much purines, no? And then the body is unable to eliminate it. For plant purines, if you are drinking more water and more enzymes, you can get rid of it easily. For animal purines, they stick in your system. They take longer to get rid of. And too much of the uric acid gets deposited not only on the joints, but also on the kidneys. So the patient with a high uric acid usually will not just end up with problems in the joints, but also kidney stones. And we will see the urine, there'll be some blood because the kidneys are being damaged. Then we check, there'll be urates or uric acid crystals. May picture ka pa ng mga ganun? Well, you will find that if you see the joints of patients that has had a problem, the small, let's say the fingers, okay, the crystals will form here, and as it keeps getting bigger and bigger, you see it getting swollen and swollen. And pretty soon, it will go like this. Okay. I've seen a patient whose foot were so markedly deformed that it cracks and open, and you can see the bone there. And so it's like a cauliflower thing, and it's just bleeding and rotting, and he still eats his high protein, high meat diet. So he didn't know that everything is coming from his diet. So I came to him and said, look, you cannot walk anymore. You've been bedridden for almost a year. And I see his diet. I said, you have to change it. And I had him, well, he couldn't find like enzymes, so I gave him lots of papaya extract, green papaya extract for the papayas. We have that in our enzymes. But it was terrible. The big mass on his toes. Instead of being straight, it's so, well, he can't, nobody told him. They just give him medications to lower his uric acid, and tell him what food not to eat and so on. Yeah. So I tell them, if you don't really slow down your eating meat, butchered animal, you're gonna get butchered. No? Diba? It's nicer to say it in Filipino. No? Pag hindi kayo nagtigil sa pagkain ng karne, kayo ang kakarnihin ng doktor. Di ba mas may impact, no? Okay. Arthritis. Okay. So the symptoms will be joint pain, stiffness, inflammation, swelling, or difficulty moving the joint. Okay. So sa medicine kasi, just cover up the joint pain, the stiffness, well, it happens, no? Relieve the swelling, and then replace the joint, you know? So that's especially for the knee and the hips. Okay, and sometimes they give injections. This is what I'm talking about. They have this bone spur, but in the arthritis, this is so gouty arthritis, so enlarged, and when you open it, this one is coming out. No need to do surgery. It's already bursting open. No? Yeah, terrible. Okay. So the medical way, pain relieving creams. You apply omega oil. You know all the omega oils, the Bengay, the efficacy oil. It has a component. I forgot that component that destroys the kidneys.
Camphor? Is it camphor?
Camphor, I don't know if it's the camphor, but you know you're using camphor to kill the cockroach, no? So you apply it in your body, di ba? And so acetaminophen, pain relievers, non-steroidal anti-inflammatory drugs, and as I said, the side effects of bleeding, hyperacidity, liver problem. Then, you know, they do joint aspiration. If these are the joints, you have a membrane surrounding it. We call it synovial membrane. There's a fluid there. So that is, when it's inflamed, maraming fluid. So what they do is they remove some of the fluid. So then, the joints become looser. No? In Chinese medicine, what we would do would be to poke a small needle, a triangular bladed needle, on the joint so that you let out one or two drops of the fluid, so that loosens it up. Okay. But in medicine, they put a needle here and poke it and pull the fluid out. Or sometimes they inject some collagen or some steroids right there. Huh? They have to put anesthesia first. See, they're doing that. That'll be adding insult to injury, no? Then surgery. What kind of surgery do they do? Well, they can maybe remove the bone spur. These are calcium deposits. If you're taking too much calcium, you can form calcium deposits around the joint, hardening it, tightening it. So please scrape it up or remove it. Medicine, natural healing would give magnesium to dissolve the overgrowth of calcium. And this one, they're gonna be doing some surgery probably there. So they are numbing out the area. For really severe cases like what Mayor Hagedorn had and Erap, the joint, the cartilage became so thin that they decided that it will be simpler and easier, well, according to medicine anyway, we just remove the joints. If this is the leg, and this would be your tibia and fibula, okay? This would be your kneecap, and it's already eroded, so they cut this, and they cut this. And then you have a metal prosthesis here, another metal here, and basically that's your knee, your bionic knee. And so now you can run. So, but then Arab told Hagedorn, don't do it. I did it. They put a cast on my leg for several months. Then when they removed it, it was stuck. And then they had to do physical therapy on me. And I was screaming like crazy for 1 month. No? Macho si Arab, di ba? So, this gets stuck up when you have a cement, the cast. When they remove it, the muscles, the tendon, everything has atrophied. No? So now you're going to have to do physical therapy to loosen that joint. My thinking is, I'd rather do physical therapy now and strengthen that joint. Simpler, no? Anyway, we helped Mayor Hagedorn, we got the problem fixed. Okay, so the natural way. Okay. Well, what caused the problem? If it's uric acid, is it inflammation? So there are ways to cleanse out toxins and inflammation. So we do cleansing diet this way. Okay. Our body is self-healing. I keep sharing that with you. No? The basic concept of natural healing is that the body can heal itself. That if you give the cell in the body everything it needs, food, proper building materials, optimal environment, and you eliminate waste, it's gonna do its job. It's gonna repair, replicate, duplicate. Now, too much toxic overload then you end a problem. Osteoarthritis is not only caused by weight bearing. So if this is your joint, your knee, you got this joint, you got maybe this joint here. If you're too heavy, you're gonna be thinning and killing the cartilage, right? But you see, you have small blood vessels supplying blood and nutrition to this cartilage. If that gets clogged up with cholesterol, so less nutrients on the cartilage. Walang blood vessels sa cartilage. So you are not giving it proper nutrition, and then you have a weight problem, or you're overusing that, maybe for those who are joggers or marathon runners or repetitive movement. So this gets thinner and thinner until then there's pain because they're rubbing it against each other all. So it's supposed to be your shock absorber. It's supposed to stretch. So it's filled with a gelatin-like fluid, so it's your cartilage. But it's gotten thinner and thinner, it's not smooth anymore, then you have the swelling and so on. So that's what happened. So cholesterol can block the blood vessels supplying your cartilage. Or uric acid is deposited there, or your immune system is attacking that joint. So, to bring back the body online, nutrition will be your number one weapon. So we do cleansing diet, we do bioflavonoids, we do enzyme therapy. Notice, this is when we treat cancer patients, when we treat blocked arteries, when we are trying to clean up the system. Not only do we do cleansing diet, we do enzyme therapy. Clear it up. No? We use both plant enzyme and animal enzyme to just clear out the system. Diba? As I said before, a clean machine works best.
Right.
So then fasting. For patients who really have very swollen legs and so on, we tell them, go on a fast. Maybe a few days fast. The swelling goes down. The body does house cleaning and clear out what should not be there, the congestions, the blockade. So fasting, is that expensive? You can actually do that. Now you fast the patient, water therapy, and just do enzyme therapy. You get very good results. Huh? Block a heart, block arteries, block brain tumors. You can use that. No? High cholesterol, tanggal lahat yun, no? So we do that. Amino acids like glutathione, vitamins like vitamin C, vitamin E, minerals. They're giving certain supplements from joint team, and we'll talk about it later. And of course, there are some specialized techniques like acupuncture, herbal therapy, some detox therapy, exercise and weight management. Now, exercise. If your joint is already eroded, you're not going to be exercising like crazy. No? I told you before, the exercise should have a full range of motion. There should be some resistance. There should also be relaxation, but you should not overuse it. So when we reach a certain age, we should exercise, yes, but too much of a good thing is not good. So maybe for those with joint problems, maybe 3 or 4 movements at a time would be enough. And probably not be fast movement, slow but gentle. Okay. So what do we need the cleansing diet for? To shorten the time that the food comes in, comes out, to speed up absorption of food, to conserve vital energy and enzymes. See, even before the advent of life enzyme, we were already doing lectures on enzymes. Cleans up the blood and system, purities, develops willpower and spirituality. Okay, so we liquid diet, we blend everything. Yeah? So that you have more enzymes, so your own enzymes are utilized by the body to do house cleaning. So blend your food, it will clear it out. Now, problem is when you are relieving the uric acid, it becomes more painful. So we have patients, we come, all his joints swollen because of gouty arthritis. We have a very overweight dentist that could not even move his fingers and legs, and he could just lie down. He was very fat, and he kept eating and keep swelling, and the allopurinol and the pain reliever is not working with him. We have admitted him, did the work. By the first week, he was screaming because all the swelling are going down, but he's still having pain. So we have to clean him up very fast. We give megadose of enzymes when you have that. The enzymes lowers the inflammation. opens up circulation. But eventually it did go away. He felt good. He went home walking. But the first week or so is hell. And very painful for him. And there's faster healing response, no limits on intake and physical activity. If you're on liquid diet, take as much liquids as you can, and then you can move or walk around. Then the raw vegan diet, that one actually is effective in the sense that the fiber makes the patient full. So, feeling niya busog na siya, he's full, he's not gonna eat anymore. The liquid diet's drawback is he drinks the food, and then he urinates and he's gone, and he's hungry. Whereas the raw food, solid food, he eats it, the fiber expands, and he feels full. So the fibers work very well when it comes to making him feel that he's sated. And then the water diet is for severely compromised cases, but I would give supplements so that the patient doesn't feel yucky or weak when he's doing the water fast. Right now, we have a patient that came and he had a tumor in the area of the brain that they cannot operate on. They were asking for $500,000 for them to do surgery, and the guy was just a tricycle driver and the wife was the one with the problem. So that's what we're doing now. She was admitted yesterday. One eye is already blind, the other one can still see. One side paralyzed, and the tumor is right in a very vital area that they couldn't do surgery. We admitted her. She is now on a water fast, and we're giving her enzymes. And I'm excited to see her tomorrow, to see how she is.
Wow.
She was brought by several a Catholic group, a nun, and they're from Sacrifice Valley, which is a place where there's a lot of devotee that stays there. And I told my staff, she is going to be helped because the Lord is the one who sent her here.
Yes. Right.
Doctors would be afraid, other doctors would be afraid to accept such cases. Okay, so, and modified diet, you choose which one you do. Maybe you got a fruit diet for dinner, or maybe liquid diet, or maybe water diet for dinner, or maybe once a week you do a cleansing diet. For patients who do not want this drastic change, maybe all they have to do is eat liquids for dinner or eat fruits for dinner. That's good enough. Huh? And then we do the enzyme therapy. What are the purpose of the enzyme therapy? To facilitate the digestive process so you digest food better. Sometimes rheumatoid arthritis is caused by the immune system reacting to certain chemicals in the body that were undigested protein from the food that they ate. A person may have very poor digestion that instead of making the food in smaller molecule before being absorbed by the small intestine into the blood, they're bigger because they were not fully digested. It can be because the patient is drinking lots of water or not chewing enough, no? Or eating so often the digestive power is already weak. So when they take the food, it is dissolved but it's not in the smallest molecule possible. Okay, it goes to the intestines, it goes to the blood, still in that big molecule, and the immune system starts attacking it. So that is what led to allergies and autoimmune problems. Now, if you give enzymes, especially plant enzymes or animal enzymes, you're able to digest food better. And then that improves the body's ability to maintain a balanced health. It also purifies the blood, it strengthens the immune system, enhances mind function, enhances the colon, and makes your blood alkaline as well as your urine. So, you get this, your body will work better. So an example of an enzyme from plants would be bromelain, which is from your pineapple. Although you get bromelain more from the skin of the pineapple than from the pineapple itself. So, yes. But we don't eat the skin, right? So well, what you do is you chop the pineapple, you remove the skin, you squeeze that skin over the pineapple, and it becomes many times sweeter. So the enzymes convert that into sugar. Okay. Next, the other one is papace from papaya, which increases the production of prostaglandins to protect against further joint damage. Prostaglandins helps prevent further deterioration of the joints. Okay. So papace is from papaya. So I use this for my patients and I've saved some patients' lives from their cancer We give them green papaya, the tumor shrinks. Well, the right papaya already has utilized the enzymes. The green has more enzymes than the right papaya. You juice it, yes, or you make it into salad, but we juice it. Chara, yes. Then, of course, we do acupuncture. The acupuncture can relieve pain and also stimulate healing. So they've done studies, they've done x-rays for those who do acupuncture and for those who don't. They saw repair, regeneration of the joint. Of course, it also has an anti-swelling effect. So you don't just give pain relief, but you also stimulate healing. So the US research that comes out now is that they found that these meridians have a direct channel to the brain, stimulating the immune system. And then some herbs, aloe vera, it helps with regeneration. No? Cayenne for pain, one of the number one we give is siling labuyo for pain. No? It stimulates circulation, so when swelling goes down, and it helps with swelling. Yan, siling labuyo. Yes, galing, no? Pain relief for other organs as well. So maganda po siya. No? Celery, yan, it's also used for pain relief, arthritis. Ano sa Tagalog ng celery? By the way, wala dito, for uric acid, we use pansipasita. And the bitter herbs, ampalaya, all the bitter herbs eliminate sugar and uric acid from your blood. So garlic boosts the immune system. If it's an autoimmune disease like rheumatoid arthritis, we boost the immune system. That's the difference with us when we're treating patients with autoimmune disease. No? Medicine destroys the immune system. Alternative medicine boosts the immune system, brings it back online. Kasi the immune system, soldiers got crazy and started abusing people. So what we do, instead of killing the immune system, we rehabilitate the immune system. Why are you doing this? What's wrong with you? Oh, we don't get paid enough. Oh, we are drunk or addicts, drug addicts, or mentally imbalanced. So you try to rehabilitate. Because if you kill the immune system, you don't have any protection anymore.
Right.
Okay. Plus the side effect of steroids, kidneys, liver, osteoporosis, your immune system goes down. Ang daming side effect na. There was a patient that we had. She was, I think, 70-year-old woman, and 15, 20 years ago, she had severe arthritis, so the doctors gave her steroids, and the pain disappeared, and swelling also. So she started taking steroids for a long time. Right? She was about this high, she started getting smaller and smaller, and all her ribs stuck. So you could see her chest going like this, and like this, because her spinal column collapsed. So she was like this. Now she was not like that before. Here and the back. And I said, what the pain? And she was now in pain all over because of the osteoporosis. I said, what did you do? For 10 years, 15 years, she was on steroid. Kasi effective yun. We cannot do anything about that anymore. Pero you get horrified. If you have to take steroids, take it in short time. Because your immune system will have reaction to your bones, your sugar, your cholesterol, everything goes up. Fragile bones, and yet your weight goes up. Not good, no? And then your sugar and cholesterol also goes up. Ginger and turmeric, they are anti-inflammatory. They bring back the immune system online. Very nice, no? Very nice. Of course, it's anti-cancer, it boosts the immune system, but there's a lot of other good things that turmeric does. They do juicing, no? Anyway, so zinc, omega oil, no? We use it for inflammation because omega oil would be your fish oil, your olive oil, flaxseed oil. Okay, so the BCO would probably be helping, but it's not considered really as omega oil. You can take it, it's good for the nerves. Okay, so it's very healing. The omega oil will help you loosen up the joints. So when you wake up in the morning, it's not painful. Yeah? When you sleep at night, everything gets stuck up. You're not as active. So you wake up you have to warm up the joint before you can move. But if you are well lubricated, you're taking your mega oil, when you wake up, there's no stuck up joints. Okay, and then B complex for nerve function and to increase blood flow to promote good circulation. Vitamin C as an antioxidant, and then chondroitin and glucosamine, that's the brand name Arthro. No? So the chondroitin helps repair the cartilage, and the glucosamine the same thing. So it helps. But even if you repair that, if it's stuck up, it's not gonna work. So you have, when you're taking this, you should be doing physical therapy. Diba? There are people doing bodybuilding, they're using their dumbbell or their barbell. But since they're not lifting it up to its full movement, what happened is it eroded the joint. So now they can only lift up to here. Naukod yung joint nila. So what can you do with that? So it's because their exercises, they have wrong exercises. So that's the type of sports injury. Now, some people are sensitive to what we call the nightshades family. You know the nightshade family? That's your pepper, that's your tomatoes, potatoes. There's a chemical that that blocks enzymes in the body and produces pain and allergies. Yeah. So they call it sotanine. It blocks enzymes. So green papaya actually has that, but green papaya I use because of the papays. So it's okay. But eggplant, tomatoes, and white potatoes are notorious. Or it's not a vegetable, no? Eggplant, tomatoes, white potatoes are notorious for that. And we tell them, oh, don't eat the eggplant. It's actually not a seed. It doesn't increase uric acid, but it can stimulate. It blocks certain enzymes, so pain is caused for those with gouty arthritis. So it doesn't increase the uric acid. Then we have some techniques that we do: cellophane wrap. If there's a joint inflammation, we can wrap it with cellophane, with charcoal or herbs or clay or mud. One of the poultices that we use for application would be, strangely enough, eggplant. Mashed eggplant. You apply it to that swelling on the joint, and then apply it overnight, and the pain goes away. Raw. Kasi we tried it. For normal osteoarthritis, we apply charcoal, pain goes away. But for gouty arthritis, because it's still there, and you are sort of really mobilizing it, the pain gets worse as you try to do cleansing. So we kept looking for other ways to remove the pain. When we tried the charcoal, it didn't work. It was actually more painful because the charcoal was drawing the uric acid through the skin, no? And then we tried the eggplant wrap or eggplant poultice, and it worked. So now if you have patients with severe gouty arthritis, we use the eggplant method. Okay. And then water therapy, you can do hot and cold treatments. You can do clay, you can do massage, because you really have to move that. If you don't move it, it will get stuck up. So even if it's painful, well, we tell them exercise. But how can they exercise if they're so heavy and it's painful? So you have to get rid of the pain, and you have to lighten up the patient. If he cannot move, you have to move for him. So you do massage. Okay. So lose weight, all right? So there are passive ways, passive exercise to, such as massage, acupressure. It does almost the same thing. You make the blood flow better. But you know, if he's gonna do the toe exercise, he can't even see his toes. No? That's so hard to.
You can't see the
Unless they're swollen.
So Hippocrates said the individual, given the right amount of nourishment exercise, not too little, not too much, we will have found the safest way to help. It's just a simple. Okay, it's here and there. No? Okay. So anyway, I don't know how to fix that. Huh? Kasi may nakasulat doon eh. Anyway, that is the simple way that we would apply. Some of them are meticulous na. Some of the acupuncture, it will depend on what points you put the needles in. But let's say for acupuncture, we can use lasers like this. Okay? So there are points of the knee that you can apply the laser on. So if you have an internet setting, You can say, oh, what points do I cheat for arthritis of the knee? Then it will come out, and then you can use a laser on that point. Yes, this one will work. Okay. If there's problems with swelling, then you can apply the eggplant poultice if it's gouty arthritis. If not, you can use charcoal or even clay overnight. Or you can use paraffin. I think I taught you how to do the paraffin treatments. Did I not? Okay. So we have a lecture usually that's called the 3 or 4 clay C. So C would be cleansing diet. Okay. Charcoal, clay, and the other one is candle treatment. So you can apply. If it's, let's say this is the hand with all the arthritic joint, no? They're all painful, you can hardly move it in the morning when you wake up. So what we do is we take a container and fill that with candles, maybe the white kind of candles, maybe during November 1, you know, start going to go to the cemetery and start collect the white ones, yeah? Never mind the other colors. And then you break them and put them in a heating container, no? In a fire. So you soften it and melt it. Then maybe add a little bit of coconut oil, no? So when it's warm, it's in liquid form. And if it's very warm or hot, you put your hand in there. Remember, it's melted. You added oil, no? So you go like this, yeah. Several times. A film will form over it. Keep going until you have a glove. You know? Then you take plastic and wrap it. So you can keep that for an hour or so. Or if you want, you can. Yes. And then maybe after an hour or so, you can remove. Some people would even keep it overnight. And you know, when you break it open, the hands would be loose and supple. The skin would be nice, and the impurities would have been absorbed by the heat thing. They're using it for beauty treatments. They're painting the face and the body for this. So, and this is reusable, huh? This is reusable. We call it paraffin bath, huh? Paraffin bath. This is something being used in physical therapy and also in some spa or beauty. But for physical therapy, we use it for arthritis. So that's an example of a physical therapy modality. So just because you are not medical doctors doesn't mean you cannot do this. See, cleansing diet, charcoal, clay, and candles. 4C. The Bible says that the Lord wish above all things that we prosper and even as our soul prosper. So if you do your part, then God will do His part.
Right.
So very simple, right? So questions, you can deal with details. English, no? Okay. Question about the topic. Kasi cleansing diet, alam nila yun eh.
Liquid na yan.
Yes, fresh. Kasi if you cook, probably the active ingredient will be lost. See, the nightshade family, although we don't want it to be taken for those with arthritis. For example, potatoes. When you chop it and put it in water, that can help lower blood pressure overnight, no? Soak it in water overnight, then you can drink that water. It can lower blood pressure. That's a strange thing it does, no? Okay, and then now we have the eggplant. And there are some variation that the eggplant too can be soaked in water and it helps with other ailments. So they're not really that much of a favorite, but it can help. Overnight in a fridge. Okay. Now that got stuck up because you're not really exercising that much. So maybe 3 times movement of your neck. When you do your neck exercise, you stand, your legs far apart, because if your feet are together and you keep doing that neck exercise, you're gonna get dizzy, no? So you go very slowly. You go like this. When you go like this, go back. Like this, go back. Must be 2 or 3 times now. You know, like this, 10 times, 10 times. May arthritis na nga, you already have weak joint, then you're gonna be... The thought of no pain, no gain is the Western mindset.
Right.
And they end up with all sorts of problems
Right.
afterwards.
With pain.
Okay, in Chinese medicine, they say soft but gentle. So you look at those Tai Chi instructors, no? Very slow, very gentle, but they can hit you and you feel it, right? Very, very gentle. So you don't need to be so gung-ho about it. Maybe when we're younger, okay. No? But when we're older, we need to be more relaxed, no?
How many cases of garlic to be able to profit daily intake?
Well, do you remember the digestive tonic I gave you before?
Yes.
Okay, that's good enough po. Maybe a tablespoon 3 times a day, the concoction. For those who have, who were not here, no? Kasi this is an ongoing lecture eh. So you build up on what has been lectured in the past and you just keep building up on that. So, since omega oil, diba? Extra virgin olive oil will be a good base. So your omega oil is already anti-inflammatory, huh? It thins out the blood, it helps with better circulation, it's a very good lubricant. Then apple cider vinegar makes your blood alkaline and helps dissolve uric acid. Diba? Kasi acid yung uric acid. So 1 bottle each, then you take 2 garlic for anti-inflammation and boosting your immune system, 2 onions for your quercetin, your bioflavonoids, maybe 1 to 2 yellow ginger, your turmeric, and then papaya, or may green papaya ka na, no? And then pineapple, so you have bromelain. See, that's already a good combination. Then maybe several siling labuyo, no? Yes, achara is good, huh? Yes. Okay, so you blend everything if you want. Then mix. So you take a tablespoon 3 times a day. Okay. Maybe it depends on the budget. Some people can only afford a smaller one, no? The normal extra apple cider vinegar will be 250 ml, di ba? Or maybe you can, for those who are saving up, maybe less than that, no? Or if it's 250, mas maganda. This will last you for more than a year. You know?
I make it an additional with
Honey.
palaya.
Palaya, yes. You can add, because there's a concoction where it's just apple cider vinegar and honey. Okay, samahan mo ng honey. Then you put ampalaya for your diabetes, di ba? Although even with this is already for anti-diabetes.
Instead of honey, I put it of course additional fruits.
Yeah, that would work too. Yes. Well, some patients would have diabetic would have problems with honey, but then you can add just a few teaspoons of honey just to get result. Remember, honey are from phytochemicals, di ba? Phytochemicals from how many thousands of plants?
Right.
We cannot ever duplicate honey. Because the bee went to all these plants and then put them together. Or maybe, like I said, we'll duplicate it, no? 150. But it's gonna be hard for us to duplicate honey. So, any question? See, mabilis lang, no? I like it when it's short. Okay. Now, a slip disc will be like this, and this is very critical, no? See, if the disc continues slipping, then you will lie down for the rest of the time. This is the spine. Okay, then there's a disc. This is actually cartilage, huh? Yeah, so this would be your vertebra, your spinal column. Okay. So if this is the spinal cord, there'll be nerves coming out the side. Yeah. This can move, maybe sidewise or frontwise or backwise. So this is a side view. That can happen if you're lifting something up. This is your head. The strain will be here. So imagine mo yan, no? Magaling mag-drawing. My teacher hates it. All my books have drawings. And that's medical books. Can you imagine? So this one is moved out, and if it's moved out, then the nerves will be pinched on the side. So you can then get paralyzed if this gets pinched or this. So medicine's treatment again, really very unique thinking is remove this. Let's say dalawa sila o isa. Then take metal plates here. Metal plates here and just put screw there, so that the nerves will not be pinched. Okay. Of course, you can only do side to side. You cannot bow anymore. No? And of course, sometimes the metal is stronger than the bone, so you can erode there later. No? And so again, you're bionic. No? Okay, let's see. So he can make you better than he was before. And that's better, stronger, faster. Yeah, we look at the $6 million man before. Anyway, so what do you do? Before they do the surgery, they do some tractions. Baba natin nila yun. So this is the disc that got out of joint. Okay, so they'll pull. So you can be lying down here, and they pull, no, sa balakang, no, with a pulley here, and there's weight there, certain amount of weight. The problem is they pull that when it goes when they remove the weight, it goes back to the same way. So what a chiropractic will do is try to push that back. So go to a very good chiropractic. So what we do is we do acupuncture to relieve the pain and to awaken the nerve, because that nerve's being damaged by the pressure. We give anti-inflammatories. We try to give some exercise that pull it down. So they have what we call the inclined bench. This is your bed. You raise up one end, and maybe 1 or 2 blocks here, and your head is like this. Make sure that there's no blood pressure problem, no? Maybe for 20 minutes every day. Or they can do some stretching exercise hanging from a rope, or maybe a ano ba tawag ito? Parallel bar, no? So that they are being helped by their weight, no? So I mean, it's just physical therapy, but the chiropractic will know how much force or how many millimeter pressure it give to bring it back. Now there's already weakness because it got loosened, no? So you have to build up the muscles in this area. I'd rather do a program of physical therapy than have somebody put me under the knife. Right. You know how long it takes for this kind of surgery? 8 hours, 8 to 10 hours. So nobody wants to assist a lapinectomy. Okay, so several batch of doctors, I'm tired, you go. So, and then they cut the nerves accidentally, and you're it. Huh? So we don't really like it. My cousin in the States lifted a heavy patient and got his joint out. So they did surgery, still with pain. So I did another surgery, still with pain. Another surgery, still with pain. So now he's on pain medication. He's an addict, and he couldn't even lift a 2 or 3 kilo weight. His wife left him. Yeah, well, he can't perform, you know. So anyway, so if you have a back problem, you're not supposed to lift things like this, because you're gonna get this. You're not moving things like that. If you have to lift something, if you have to, you don't go like this. You bend your legs. Your muscles on your spine are just about this small, no? Small. If this is the bones, ganito lang kalit yung mga muscle niya, no? So they're so small. You don't use them to carry the weight. You straighten your back, bend your knee, you got big muscles in your thigh, and lift it as close to your body as possible. When you're lying down in bed, you don't get up like this. You turn on the side, you push, and then get up. You don't go like this. It's a strain in your back. Yeah. Yeah, so if you have lower back pain, find out what may be causing it. Maybe you're sleeping the wrong way. Oh, and when you're lying on the side, you should have a pillow so that your legs, like this, Otherwise, you're gonna be twisted. Your spines are twisted like this. Twist yung spine mo. So when you go like this, you should have a pillow so that your spine is balanced. Can you imagine? So naka-twist po siya. Naka-twist to. So, but if you have a pillow here, equal siya, equal. See, I wanted to be a cartoonist, you know? Like this, huh? So, yeah, I used to tell stories to kids. When I was elementary, I would tell stories, would be the hero, you know? My classmates with me. Anyway, and then I end up in medicine. Anyway. Okay, any question? Oh. It can be nerve problems, diabetes, cholesterol problem, B complex with that. Acupuncture or electrical stimulator. A feeling of pins and needles or electricity can be a warning of nerve damage or circulation problem. Yeah, it can be arthritis, it can be nerves, it can be poor circulation. If it's cramps, kulang yung calcium. Tataas yung feed. Yes, pwede siya. Pwede. Okay. So at least you help the circulation better. Huh? Okay? Ano pa po? Sino ba? Ba? Yes, ma'am.
No water aerobics po.
Okay. For patients with weak backs or too overweight and they're having a hard time, they have a hard time exercising if they're too heavy, diba? For looser joints and better movements, water aerobic would be called for. Kasi it lifts up the person. Mas lesser ang weight niya. And then they can move all the joints. So eventually, hopefully he will lose weight because he's doing all those exercises. If they really have weight problems, we give something to speed up metabolism. An example would be ginseng. Kaya lang if the blood pressure is high, we give other herbs with the ginseng. And then kelp, which is seaweeds. The ginseng and the kelp will help with the thyroid to speed up metabolism so they lose weight. Bibilis ang yung metabolism. And then they have to exercise. And before 6 diet, sleep early. If you're not sleeping early, you're not gonna lose weight. Huh? Before 6, see? We already ate our dinner. Huh? Or at least something very light if you have to eat after 6. So, when a patient with severe arthritis eats heavily at night, when they wake up in the morning, the joints will be painful. But if they were to eat before 6, they have looser and better moving joints in the morning. That's what we noticed, huh? Even our cancer patient, if they eat properly, they have no pain. Okay.
Goat arthritis, ano pa rin kung nagpapawal ng stimulation?
The purine rich, pag sinabi pong purine, that's actually high in protein. When you eat protein, the body dissolves that into amino acid. No? The body will get what we call the essential amino acid, meaning these are something the body cannot produce. No? And then the rest will be thrown away as uric acid. Kasi kukunin lang yan to eh. This uric acid it came from too much protein. Okay, so the higher your protein intake, the more amino acid, the more uric acid will be produced.
It's vegetable.
Even the vegetable, the soy, no? The mungo, no? The beans, okay? Yes, all the beans, no? These are high because they are concentrated protein. The nuts, okay? So matag. But if you have enough water, sisiw yan, you can get rid of it. But the animal products, the certain fish, no? Meat, especially the laman loob, no? The liver, for the chicken, the gizzard, no? The internal organs, no? Okay. They stick to the system. No? They're not easy for the body to eliminate. So if you are going to be doing that, increase your omega oil, at least for the fat part, and your enzymes. Para maalis mo siya, may expel mo siya. And the fruits also, no? And the fibers. So you have to do something. If you're going to eat this, do something about it.
Yung olive oil, paano kaso with oil?
Opo, opo. Remember, this oil you put in the fridge, they do not freeze. The fish oil, even in the Arctic, they do not freeze. No? So fish and olive oil are very protective. Yes. What is mega dose? Well, what is the normal dose of our life enzyme? Gusto mo bumenta. But for patients with severe tumors and blockage in the arteries, I give a higher dose. So maybe for a normal person, maybe one sachet per day would be good enough. No? For some people with a health issue, maybe 1 to 2 or 3 times a day. But for cancer, I give it a high dose. Now, there is a concern about sugar. Kasi cancer loves sweets. But if you eat 3 times a day, your body will increase the sugar in the body, in your system. Normal yun eh. So, if you're gonna be doing enzymes like sweets like this, I'd give it during the mealtime, before you eat. Anyway, you're gonna eat and your sugar will go up. So I'd use that. And the enzymes offset whatever problems with the sweet part is. No? And fruit enzymes are easy for the body to get rid of anyway. So how high inside? You know, sky is the limit. Yeah? Oh, if you're in pain, you want something to immediately get it down. You know? Yes. It's not intended for pain relief. It's intended for clearing up whatever blockade or clog up clog engine of the body.
Sobrang ng late.
Okay. So can you imagine any product with 150 things, 150 foods and vegetable there? It's fascinating. Any question? Yes, hydrotherapy, maraming, it has quite a lot of application. No? You can apply heat and cold on the joint. Heat for about 5 to 10 minutes, let's say 5 minutes, and then cold for about 1 minute. 3, 4, 5 times until the last would be maybe 30-second cold. Then dry the area and apply oil. No? That's one. Other would be hydromassage. What is hydromassage? Yung jacuzzi, no? Or let's say you have this hose and you hit the joint, the back. And while you're hitting the spine, you're doing hot and cold treatments. So pwede din po yun. Huh? Then the jacuzzi, you got all this massage flowing, so that relaxes the muscle. Actually, you can use it to relax the muscle so that the circulation is better, or you can apply so that the circulation gets rid of the inflammation. So it's for pain relief, for relaxing the muscle, for relieving the inflammation. And of course, you can also apply ice. So if this joint is super painful, it's swollen, you tried hot compress, it didn't work, you rub ice on that for about 30 minutes or less. No? And your body will now fight the cold with heat. So you rub it. Maybe 30 seconds you go rub it. And the pain will go away. 30 seconds. Yes, it will help. If it's really deep, you're going to have a hard time reaching to the point. Remember, painful na eh. No? Okay. So, what you can do, if, let's say, this is the right knee, no? And it's really swollen, they're not gonna like you for pressing on a swollen joint. No? So, you can either use the opposite joint, kasi may reflex joint dito, you press on that, or you look for distant points in the leg or in the hands that you can use to help with general points. And remember the general points I taught you before? Here, the stomach 36, no? So, any problem, you can use that. No? The new ones, you don't know that, no? So, there are ways. Like, let's say you have a cast on your leg, you can do therapy on that leg, you can do therapy on the opposite leg. Kaya po tinawag reflex. Means it has another reaction than what you're doing there. Apo. Okay. Your Yakult and yogurt has B12, cyanobalamin. That's for, but the B1, B6, you find that in vegetables and vegetables and fish. They would have that. B12, cyanobalamin is produced by your good bacteria. And so that's why we want the yogurt in the food. So the rest of the B you can get from food. I mean from vegetables. But you can also get that already in tablet or capsule form. It's even in injectable form. Okay? Wala nang question? I have a very good group here. So, I hope you learned something about arthritis.
Thank you, Dr. Dizon. As always, very, very privileged to have you here. Just a few announcements. Dr. Dizon will be here on July 16th, and he will be talking about the immune system. So please put that in your calendar, mark it down in your day timer or whatever, and make sure that you are here on the 16th to listen to him as well. Because we're talking about the immune system, so I'm excited about that. And then also on Thursday we have our Soaring High workshop at 2:30, and so please come here. I will be speaking on Thinking and Growing Rich next week, so it'll be exciting, and you can be part of that as well. And so I just want to thank you all for coming tonight. Thank you for your attendance. Thank you for your attention, and good night, and have a great rest of the night. Take care. Bye-bye.